45% of women between the ages of 35 and 54 learned about perimenopause through social media, not their doctors. Hi, I'm Tanya.
I'm Erin.
And if you've ever thought, is this it?
Pull up a chair.
This is hella good living.
We don't do midlife.
We do more life. Cheers.
Cheers.
Today, not our pretty cups.
Water day today.
Yes, no kidding. Hydrate. It's actually hot here in Michigan now.
Yes.
So, all right, today let's talk perimenopause. Now, if you go back and you haven't watched it already, episode 2 is where we talk about just perimenopause in general, but like the symptoms that come along with it. So we won't go back through all of that, but we know there are common symptoms that women see. Those symptoms lead you to go, the hell is wrong with me?
And end up probably at a doctor's office.
Exactly. Or trying to self-diagnose. So we're going to talk a little bit today about how both of those things work and factor in and what you can do about it. So I want to start it off with the statistic that got me thinking about this, which is 45% of women between the ages of 35 and 54 learned about perimenopause through social media, not their doctors.
I believe that, actually.
Only 34% have discovered this through a medical provider first, without first seeing the symptoms and saying, oh my gosh.
Yeah, there's no preparation for it from your doctor.
No. And I mean, we know, we've talked about this before too. Our parents, our mothers obviously went through the change, but it wasn't discussed. They never told us, like, here's what you're going to be looking forward to. Here's looking forward to.
Right.
Or not looking forward to, but here's what you can expect.
Well, and I would say the first symptom I had was a hot flash. I mentioned it to my mom. She was like, oh, yep, menopause. I'm sure you're going through menopause. Hormone replacement therapy you need to go get.
Okay. You did tell me that.
Yep.
Yeah. My mother, I got nothing from.
But that was my mom. And that was the time when just the new study came out that said that we could do hormone replacement therapy again. Thank God. But yeah, I go for annual exams. I have a woman doctor. She never mentioned it one single time.
No. And I mean, I went in with a lot of different symptoms, but the biggest one for me was kind of the brain fog and everything else that comes along with mentally how you are functioning on a daily basis, not necessarily physically. And I just got a lot of, well, I'm sure it might have to do with your diabetes.
Oh, yeah.
And endocrinologist said the same thing. And, you know, so the PCP that I had,
yeah,
no help at all.
Yeah. I would say dismissed pretty much through everything. Or, yep, that's normal.
Yeah. Right. So just deal with it. That's normal.
Okay. So I have no options is what you're saying.
Right. So go to, first of all, you're going to most likely, as you said, they're going to go visit the doctor. The doctor's going to say it's normal. They're going to get dismissed. Basically, what we're going to talk about is if you've ever felt that way, what you can actually do to make sure that you get the help you need and not just allow yourself to be miserable.
Right. Well, that and to basically, I think another common thing that happens is that the PCP picks apart the symptoms individually instead of looking at it as a whole, the big picture of I'm perimenopause and it's because all these hormone changes that now I'm having all of these symptoms versus, okay, you're going to put you on an antidepressant because you're feeling depressed
so many times.
And we're going to put you on this pain because go to a PT because you got frozen shoulder, and you're going to go do this because a GI doc because you have gastrointestinal issues.
You just went through every single thing that I had done.
Right.
I had the antidepressant. I had the PT for my frozen shoulder. It's like
clockwork.
Years of it, I think. And I didn't even realize it until all of a sudden at 50 was when I was like, okay.
I'm 50 now, so there's
got to be
menopause.
There's got to be a reason beyond what these things are accumulating. Well, and we have a girlfriend who was like, oh my gosh, I have been seeing this specialist, women's health. She deals with perimenopause. And we both went, love her.
Oh my gosh.
Immediate relief on so many levels.
She truly was like the light, moment when she sat and she listened and she had information and she was like, tell me, just give me the information. I can help you. And it was like, finally.
Yeah. Yeah. And when you say she listened, I was probably in there an hour.
Yeah.
She was awesome.
Yeah. Highly recommend, if nothing else, you find that person that listens to you.
Well, and that's what we're going to kind of talk about. Your doctor may not be the one that knows anything either.
Right.
we're going to dive into some stats. So I'm going to read those off a little bit, but only 31% of OB-GYN residency programs have a menopause curriculum at all.
That's
And
disheartening.
that's because OB-GYNs were like, okay, you basically are there for up to the point of a woman birthing children.
Right. Mm-hmm.
Which is, again, another crazy thing that I didn't realize when every doctor says, well, 35, your clock's ticking. Well, that's because that's when
All these estrogen changes.
all those levels start to begin to drop and your body does change.
And then they're like,
yeah. So OB-GYNs were taught to deal with that part up to women having children.
mm-hmm.
And then after that, there was really no education on it.
Right. And that's a recent
Yep.
study.
Yes, 2023.
Wow.
And published in the Menopause Journal. Fewer than 7% of residents feel prepared to treat menopause patients. So that one's a little bit older. It's a 2017, but it's still the most cited data because nobody else has done a study since then.
Doesn't it just make you feel like you're just out to pasture?
Well, yeah.
Like unseen, forgotten, like it just all goes along with, it feels like what this age is.
Yep.
And it's like, no, I'm not okay with that.
And a lot of women, unfortunately, just they feel that way and they allow that to continue. They're like, they don't go. And this is us really encouraging the listeners to be proactive, take initiative.
Talk about it. It may be uncomfortable
Yeah.
to talk about some of these symptoms, but go and talk to, I mean, you got to start with your doctor, but start there.
Because it doesn't just affect, you physically, mentally in your own little bubble. It affects your relationships,
To your partner, to your kids, to your
friends, to your employees.
Mhm.
That is one thing I have seen more of because I'm on LinkedIn a lot. There are specialists now, women primarily discussing this at corporations because they're going in and saying like, this is a factor. This is something that you just assume, well, they're getting old. Well,
Yeah,
no,
right.
they have neurological changes happening
Mhm.
that are causing them to not be able to function the same.
Right. Right.
So another stat, 1 in 5 family medicine, internal medicine, and OB-GYN residents, 1 in 5 receive 0 menopause lectures during their entire residency. So they're saying like out of 5, maybe 4 of them heard a little bit in a lecture. But that is it.
Awesome.
So 85% of perimenopausal women experience symptoms that clinically impact the quality of their life.
So true.
60% will seek help. 75% of that group, of that 85%, will go untreated.
I believe it. I believe it because you have this underlying thought that you're crazy. Like,
Yeah.
this, I don't even know other than to say that. Like, even in your own brain, you're like, this can't be all the same thing. This
Right.
can't be all hooked together. There just must be all these different things wrong with me.
Exactly. Yeah. And I think back to at least your mom went on hormone replacement. It sounds like my mother did not.
Mm-hmm.
And it was a long process.
Well, and my mom was like, it is life-changing. And that was back before it was, I think it's bioidentical now. I mean,
Right,
hers
right.
was, who even knows what they were putting on her then, but
Well, and then after that, there also was that gap in time where it was, oh no, hormone replacement therapy is horrible.
Yeah.
And it's
It
going
causes-
to cause cancer and you're in
Mhm.
trouble. And now, of course, studies have shown that is not true.
Mm-hmm.
Especially with the way that they've obviously changed some of the hormone replacement therapies out there. They're more safe. They're more effective. They actually are what your body needs
Right.
and not just like a chemical.
Right.
So yeah, I didn't realize, and maybe some of the listeners know, that when I went in to see Dr. Arnold, she was like, let's run the labs. And I was like, I always get labs. I'm a diabetic. Like I get that part. I didn't realize there are labs that will technically show
Yeah.
if you are in perimenopause
Mm-hmm.
and labs that will show when you are menopausal.
Mm-hmm. Yeah.
I had no idea.
Well, I didn't know that either, but she was the one that told me.
Right? I'm like, you're looking for what? She's like, we look at these levels and it obviously shows us that, your estrogen, your progesterone, all these other things are decreasing. And once they decrease to a certain level, you're considered perimenopausal.
Mm-hmm.
Because again, another thing that women experience that leads them to the doctor is their periods
Right.
get disruptive.
Well, and that's the thing, but you've had an ablation, right? So
Yes.
you didn't know exactly when you were having yours. I have always had an IUD of some sort, so I never knew, and it's just
So true.
like, how do you even, like, that's not the gold standard anymore to go by of,
Yeah.
I haven't had a period for,
Right.
12
Right.
months, so I must be menopausal now.
And I
So
don't know
hard
if
to
women know
know.
that either. And the other side of that coin is some people's periods get worse and closer together before they start to get further apart.
Yeah. So there
So-
was a time when I didn't have an IUD in, and that's exactly what happened. It would be like 15 days, and then it would be like 70 days, and then it would be 15 days, and then it would be like back on track for a while. And I was like, what is happening? Never, ever actually even dawned on me that it was perimenopause that was happening. I was just like, I didn't know. There's something wrong with my periods. I'm just getting old.
Because again, it wasn't discussed.
I'm just
there
getting
was
old.
not the information out there that we have now, right? Or just like, I'm unlucky. I have a shitty period.
Well, and I do have to give a shout out. Our old college roommate texted us out of nowhere the other day, and she had listened to one of our first episodes.
Episode 2.
And she said, first of all, I felt like I was in the room with you, and it felt like our college days, which was really cool.
Yeah, that's
but
awesome.
the better thing was, she's like, I made an appointment with my doctor because I was like, what is going on with me?
And that's crazy. She's our age.
She's our age, yes.
So how long has she been dealing with these symptoms or questioning herself and not doing something about it?
And this is a girl we haven't seen in probably 2 years at this point.
Yeah, probably.
We stay in touch here and there, but really, and so it's if you're not having the conversations with your friends, if you happen to have a sister, with your parents, how are you finding out? Because our doctors aren't doing it.
Well, that's the next piece of this.
Well, there you go.
That's a great little segue. Social media is filling the void, but that's complicated, right?
I would say
That's complicated because how do you know
the information you're
that
getting.
the information is correct? So again, going back to that stat, 45% of women 35 to 54 learn about perimenopause from social media.
How many? 35%?
45%.
45%.
Yeah. Only 34 figured it out from their medical
Almost
provider.
half.
Yeah. Yeah.
From social media.
And so we're going to talk about that a little bit because it's great. It's
Crazy.
great that it's now at the forefront and we are talking about it. And
It is,
people
and
are
there's some big pioneers out there.
Absolutely.
OB-GYNs and doctors, females that are really doing some really great work out there.
Yes, and actually we'll talk about that in a little bit too, that they're taking it right to the government. Now we're getting like funding and things like that for research and so that's huge. So Meno TikTok is a real like category that you can go to TikTok and you can search Meno and it will be everything about perimenopause and menopausal women. How accurate are these people?
Who knows, right?
How many of them are doctors? How many of them are like this person that just wants to get followers? Or how many are like us where it's continual research that we put into it and make sure that we check the stats before we say anything? And there's just so many different avenues, and God forbid the advice,
Right. Yeah.
the nonstop, like the supplements and the activity and the this and the that.
God.
And now I'm not saying they're wrong.
No.
Some are great. Like we are going to encourage you, and actually part of our perimenopause guide that we are putting out talks about not only the medical side of it, but also the symptomatic side of it, things you can do to ease the symptoms, naturally, et cetera, et cetera. But I mean, there's like, you got to practice this.
Yeah.
You got to try little different things and figure out what works for you.
Right. And really, truly, just in typical woman form, everybody's different. Something that
Yes.
works for you does not always work
Yes.
for me.
Yes. So yeah, I'm going to recommend something if it works great for
try
me.
it and see.
Try it and see. But how daunting is that sometimes?
How many times have I said, what supplements are you trying? I don't even know where to start. What should I do? How? Because you're like queen research of supplements.
Yeah.
And you've tried a lot of them. Me, I'm more the, get to the gym, get outside, touch grass, know.
Right.
So
Which is also good.
we tack it kind of a little bit differently, but really you need both and all of it. And how do you figure out what's going to work for you?
You got to figure out the basics and go from there. The issue that I have with social media, like me personally, is that like I see something and I go, oh, that looks great. Like I should get that.
Right.
But then I've learned to like dig in deeper.
Mhm.
I go to apps that I use for like supplements and things like that and get ratings based on actual scientific
Right.
studies and
Right.
versus just this is the top seller on TikTok shop.
Right.
I have fallen for that.
For sure.
I have tried quite a few.
All the things.
Quite a few.
Right.
Some I'm like, this is great. I can see it's working. This is the other thing though, you really got to track that shit.
Right. Well, and here's
Because if you're trying 6 things at once and you're
How
like,
do
I
you know?
feel better, but I have no idea which one it is.
I'm not sure which one it is. But also some of your symptoms are very different than what my symptoms are.
Yep.
So something you'll try, I'm like, oh, well, yeah, I don't need that. And maybe it's I don't need that yet, or I
Right.
won't need that ever. But it's just, yeah.
We are also going to be putting out a supplement guide for perimenopausal women or women 35 and up because it can get overwhelming. And you don't necessarily, again, you see an ad here, you see an article there, but nobody's bringing it all together and saying like, here's a list for these symptoms.
If you are suffering from this,
These are the ones that you can attempt versus like that blanket statement that I hear on a lot of ads, does this, and you're like, okay, I just need this.
right.
So am I going to get out of this product enough of what I need versus what is just going to sell it for everybody?
Right.
So,
So
yeah.
true.
The other thing that is a risk with social media, and you touched on this a few minutes ago, you said like about, pregnancy. Basically, like we get to the point of 35, that's when we're kind of done. You don't know because you're on an IUD, you got an ablation. What if you are reading something on social media and you go, you know what? I bet I'm in perimenopause. I'm good.
Right. Right.
And then you get pregnant
Right. True story.
because you're not in perimenopause. Your body's still kicking.
right. Right. So true.
I mean, we hear this from people, the like, oopsie, I'm 40 years old. I was not expecting this because doctors said after 35, it gets harder and harder.
Right.
So these labs are also going to be helpful for that.
Yeah. Yeah. As much as, you're finding the information out there in different ways, really getting to a doctor that can listen and that will do the things that they need to do to explore where you're at in your body, that's going to be, and that also might feel kind of daunting because
Oh, it is.
finding someone to listen, thank God we had a referral. I feel so blessed to have my circle of friends that I have that we just have these conversations regularly.
Yeah.
It's not like taboo subjects.
Yeah.
No, we just talk about it.
There's no taboo with us, that's for sure. Yeah, and I mean, you have the right to also go to a doctor and say, are you trained in menopause medicine?
Right.
Like, if I'm coming to you, am I going to actually get really good information on perimenopause? Or am I going to end up getting another? Like, obviously, I always recommend second opinions. We got really lucky because we had a referral.
Yeah.
I had gone to see a couple different doctors. For those who don't necessarily know, and somebody asked me this the other day, they're like, well, how do you find a menopause doctor? So we personally got lucky because we had a recommendation from a girlfriend.
Right.
But a lot of the times people don't know where to go. If they're not talking about it because in their group it's taboo or they just haven't brought up that subject, they may want resources. So the one that I find was the most useful is the Menopause Society. It's menopause.org. And you can actually go to their site and you can put your information in and they will pull up a provider in that area for you.
That specifically
That
understands and is trained in menopause.
is trained in menopause.
That's awesome.
Yep. And then another organization is the Women's Health Office. It's womenshealth.gov. And so if you just you can even just Google certified perimenopause doctors. And a lot of these sites will come up.
Got it.
And
That
then
would
you
be
can
nice.
find someone in your area. One nice thing about all of this is it is finally becoming a policy issue. Legislative measures have been introduced across 15 states in 2026 that will mandate menopause education for medical providers.
Seems like a good idea.
Which just kind of makes sense, doesn't it?
I mean, there's a lot of women our age out there, but
Well, basically, yeah, just as important as it is to have an OB-GYN to have a baby, it is now just as important to have it for like you said.
Which is a realization of mine. I didn't realize I would ever be back to an OBGYN because I thought once I was done having kids, that was it. That was the end of my journey with an OB-GYN. I didn't realize you would go back for menopause.
Right. Yep. The California bill could take effect as early as this year.
That would be
So that would be really setting a precedent. And then the Menopause Society, they had an initiative that just received a $5 million donation to fund provider training. So we're getting there.
small strides, right? In the right direction.
It's just crazy to think how long women have been going through this
Ever.
right? But even going back
Yes.
to our parents,
Yes.
their parents,
This is
what
not
did they
new.
do?
Gutted it out.
Oh my
I mean, that's what
gosh.
we've done. But you think about it.
Then they're tougher than we are.
You know what my daughter just said to me? So my youngest daughter, she's 21, and she said it would be really nice if in our health classes we really learned about our bodies as far as the
Oh my
different stages of
gosh.
the month and how we should be feeling and what's okay and what's actually not okay, because pretty much it's always, oh, is it that time of the month? Oh, you
Yeah.
have cramps. Oh, and it's just like we feel now. It's just how it is.
And it's dismissive.
Yeah, and
It's
it's
so
just,
dismissive.
you're a woman and this is just how it is.
Yep.
So we've been taught since we were really young that it's just going to be uncomfortable to be a woman.
Amen. Amen. And then, these men that are just, not all men, but these men that are like, oh, it's that time of the month, isn't it? Well, I'll stay away. Like,
Yeah, that's not helpful.
Those
Just if
are
there's any
not-
men happening to be listening, that is not helpful.
yes. So I am seeing some men have TikTok channels and things like that
Yes,
where
I've
they're
seen that
talking about
too.
how do I help my wife
Mhm.
get through perimenopause
Because
in
this
a
is real.
in a positive, productive way.
Mhm.
Yeah. Another stat, 2 in 5 women who sought health care reported being dismissed, minimized, or not taken seriously.
Mhm. I believe that.
Like,
I was.
Yep.
Yeah.
I was too. Luckily, we had the third person who was not as much or had found
Or
somebody
I
who
think
was
she just was like, no, this isn't okay.
Yeah,
I'm going to keep going and figure it
she's
out.
definitely
Love
proactive.
you, Kelly.
Yes, we are trying very hard to just explain to the listeners here that you have to be proactive.
Yes. And you have to, it's okay to take yourself and your symptoms seriously and want more for yourself.
84% of women who did receive treatment found it to be helpful.
Mm-hmm.
So the support's out there. It exists. We're just still a little behind the 8 ball as women
Mm-hmm.
in any area, but medically, we're behind the 8 ball in the fact that this did not really become something on the radar until I would say 5 years ago, in
Yeah.
my opinion.
Mm-hmm.
And that's kind of when the research started. It was around about 2017.
Yeah.
I guess we've made some advancements then when you think about it that way.
Yeah. And there are just some women out there that are really doing a good job, doctors that are really leading
Yes.
the charge for us. And that's amazing because golly,
Yeah.
you just feel unseen and unheard and basically left to your own devices. And it's not the
Yeah.
place where we need or should be.
No, and we're trying to help with that. That's why we've put together this perimenopause guide. Take that, fill it out.
The symptom tracker.
Symptom tracker, you print that off or you take a screenshot, you walk into your doctor's office with it and you say, here's what I'm experiencing. And the more detailed you can get, the easier it's going to be.
Because if you're with the right provider, they can take that information and see that, yes, all these things are related. This one, however, is not.
Right.
And then help you figure that out versus a doctor that's saying, oh, let's treat this, let's treat this, let's treat this,
right.
let's treat
With
this.
6 different things and none
Right.
of it is necessarily related to your hormones.
Right.
Yeah. Go to menopause.org, find a provider if you don't already have one. So just to recap, we're telling you, keep going. Make sure that you go to your doctor's office. If they say it's not perimenopause and you still believe it is, get a second opinion.
Yep.
This gap is not your fault. This is
No.
a systematic failure. And making sure that you take that first proactive step is what's important.
Yes. Keep talking until you're heard, until you
Yes.
feel good about it.
So for the listeners, where did you guys, for those of you that have been
Great
diagnosed
question.
with perimenopause, where did you get your information? What led you to seeing a doctor, starting hormone replacement therapy,
Right. Did
whatever it is that you are doing?
Did it start on social media? Is that where you found out? Were you
Right.
having conversations with your friends? Did you have a mom that was able to give you some information?
Exactly. So share with us, comment, visit our TikTok or our Instagram, our
Mhm.
website. Let us know because knowledge is power.
Right. Yes.
For all
and
of us women.
Yes. And we want We want everyone out there to be able to live their best life for the rest of their life.
Yes. Oh, nice. All right.
Cheers.
Cheers.
Cheers to that.
Thanks for joining us for another episode of Hella Good Livin'.
If you're nodding along or texting this to a friend,
Make sure you're following us at Hella Good Livin' on TikTok and Instagram.
and find all the good stuff at hellagoodlivin.com.
We don't do midlife.
We do more life.